Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Media Medical Institute of Nursing and Hospital, Abohar. So today, I'm going to explain you about the topic that is minor ailments, part 3. Today, I will explain. I had done 2 videos on minor ailments topic. So first and second. Now, today I will explain you about the third video, the third sub part of the topic. So let's start with the topic. Okay. So next minor ailment is the burns. Okay. So I will explain about the burns. So burns, as we already know, can be from any of the thing like fire from any of the object. Okay. So what are the main management points? How we will or we can manage the burns if it is occurring on a skin or any of the body part. Okay. So what would be the steps, different steps to manage this thing? So first point is try to keep the burnt part of the body immersed in water. So that will relieve the pain, and also that will we can say that prevent the skin from itching or any type of burning. Next, check the spreading of the burns. Check for the that burns is the burn or the burn where the burn has occurred. It is localized at one place or it is spread out on the different places or the location on the body. Next, if the cloth has got stuck on the burnt part, don't try to remove it. Okay, because if the cloth is stuck on the skin, so the reason behind this is do not try to remove it because it can peel the skin off and it can cause bleeding, and that may result in infection. So don't try to remove it. But rings, bangles, shoes, belts, and other tight fitted articles should be removed because these can cause any of the mishappening or that can result in worsening of the condition. Next, don't touch blisters unnecessarily. So blisters will form after the burn. So don't try to touch them. Next, cover the burn part with a clean wet cloth because it will give a soothing sensation. Next, assess the condition of the patient and percentage of the burn. So, following the rule of 9, we can assess the patient for the percentage of the burn and reassure the patient if conscious. If the patient is conscious, ask them or give him or her the psychological support or the first aid that is to be provided. Next, if the patient is in shock, give him primary treatment and give oral dehydration solution to the patient. So if the condition is mild, the burn is mild or the severe condition, then immediately we have to provide the oral dehydration solution. Or if the condition is severe, then we have to shift the patient to the hospital. But if in case of mild or the moderate, we have to provide the oral rehydration solution because it will burns can lead to the fluid and electrolyte imbalance in the body. Okay, so that is the reason why would we give the ORS. Next, provide analgesics as these would relate the pain, and refer the patient for the further treatment to the hospital and refer all children and elderly if mild burns persist after first aid. Okay, so if the burn, we are managing the burn by providing the first aid, but if it is not getting prevented or it is not able to manage that burn, so then immediately shift or refer all the children and the elderly persons who are not capable of managing the burn or on whose body we are not able to manage the burn because the condition may be moderate or severe. So immediately refer them to the hospital. Okay, so that was about the minor ailments of burn. Next is the drowning. So drowning is in water. Sometimes the person accidentally fall in the water like the canal or the river or any other of the other water source. So that can lead to, in the severe condition, that can lead to the death because the drowning may lead to the failure of the respiratory system or the other vital organs. So what are the points that we have to follow or how we can manage that? It includes loosen the clothes from his chest because we have to maintain the airway. Make the person lie on his abdomen and get the water out of his lungs. So lungs, the word written here is lungs because we have to maintain the patent airway. So get the water out from the lungs or prevent them from entering the lungs. Next, resuscitate the patient and immediately send him to the health center of the hospital. Okay. Next are the fractures. These include the minor fractures or the major or the, basically we are talking about the minor condition of the fractures in this. So what is this? How we can manage the condition of the fracture? In fracture, we have to immobilize the part that is fractured. Okay, so that is the main thing. Next, monitor the patient's condition with fractured bones. Check the vital signs. So first thing is that check the vital signs and assess the condition of the patient on which the fracture is there. Next, treat the patient for the shock. Okay, so fracture can lead to the condition of the shock. So we have to treat the patient, and there will be the signs of the shock. Next, immobilize the fractured part of the patient's body. Likewise, I said, so we have to immobilize the part because uh, uh, to prevent the we can say that the injury to become mild or the severe. So using bandages and splint or something else like cardboard, so we have to keep that part immobilized so as to prevent that specific limb or any of the body part from being further fractured. Next, if there is suspected injury in the spinal cord, then shift the patient without moving the neck and back onto a wooden board and stretcher for the transportation to a hospital. In case spinal cord is fractured, because spinal cord controls many of the limbs or the organs like the hands, movement of the hands or the legs or the movement of the body part. Okay, so in that condition, make the patient lie down on a wooden board or a stretcher. Okay, and if the neck is injured, keep sandbags on both sides of the head and keep it from moving. So we have to immobilize the neck. Next, administer analgesic and injection of the tetanus toxoid. So that is a must given injection during any type of this accident. So that has to be provided, that is tetanus toxoid, okay, before sending him to the further treatment. Okay, so that was about the fractures. Next one is wounds. So wounds, we will talk about the different types of wound in a single paragraph. About the wounds. Wounds may be clean, punctured, lacerated, or incised. Okay, that means these are the types of the wound. Clean means to say there must be any type of scratch or punctured, like pricking of any of the sharp needles or the objects. Lacerated, it may be open, incision, lacerated or incised. So there may be the cut from the knife or any of the sharp instrument. Okay, that has we can say that cut us the body part or the skin. Skin is ruptured, like like the doctor gives incision during operation. Okay, so that is the type of the wound. So here are the standing orders for the wounds, how we can manage the wounds. So some of the points are: wash the wound with clean boiled water and antiseptic solution or the mild soap. So that is the best treatment of the first aid. That will prevent the infection. Second is apply spirit around the wound and remove all the foreign bodies present in the wound, like any of the foreign bodies that are not supposed to present in the wound, that is like glass, piece of wood, stone or dirt, from which mostly that wound is uh, occurring. Next, bandage the wound using betadine, tinker benzoin, or gentian violet. Okay. Next, give the injection of tetanus toxoid. That is must, because some of the injuries or there is a wound on the body, or that may cause the tetanus. So to prevent that, we have to provide the patient with the tetanus toxoid injection, and if not, given within the last 6 months. If the patient has already taken the dose within 6 months, so there is no need to give the injection of the vaccine again. Okay. Next, check the bleeding from the wound by applying external pressure till the bleeding stops. Okay. So we have to provide have exert the external pressure, because by applying the pressure we can stop bleeding and treat for shock if present. If the wound is in severe condition, So we have to, there may be the condition of the shop, we have to manage that. Next, in case the wound is large and needs suture or is caused by the bullet or any other weapon, then send the patient to the earliest and to the nearby hospital. Okay, so we can't manage that type of wound in home or any other condition. So we have to immediately send that uh, uh, patient to the hospital or the institute. Next, advise cleanliness and to avoid contact with dirt. That is must, because to prevent them from the spread of infection. Next, dog bite. Okay, so next point is the dog bite. So dog bite, as the name indicates, is the bite on the body by the dog. So that can cause rabies to the person, uh, okay, to the specific person. So how can we manage the wound of the dog bite or the bite of the dog? So thoroughly wash the wound with soap and water, preferably under running water, at least for 5 minutes. Okay, so the wound or the site of the bite should be washed with the soap with running water for at least 5 minutes. That is the basic first aid for the dog bite. Do not cover the wound. Okay. Next, second is apply 0.01% solution of povidone, 0.01% solution of iodine, or 70% alcohol. And if the wound is extensive, check hemorrhage. But stitches, if necessary, should be applied loosely after 24 hours. Okay, so we have to check for the wound, and if there is a need of suture, that must be applied after 24 hours. Okay, and if available, anti-rabies serum can be applied. Okay, next one is the give injections of the tetanus toxoid. Refer to hospital immediately. So in this also we are giving the tetanus toxoid injection. Next, a certain history of the symptoms of the rabies in case of the dog bite. So we have to assess for the symptoms of the rabies, like the hydrophobia. The patient will be having a fever from the water. That's the basic sign from the rabies. Okay. Next is don't kill the dog and observe it for 10 days for the presence of the signs of the rabies. If it shows symptoms of the rabies, then rabies vaccination and rabies immunoglobulin is required for the patient and all the persons coming in contact with the saliva of the animal during the observation period of 10 days. So we have to provide with the rabies vaccine, I would say. Okay, so to all the persons, rabies immunoglobulin to the persons who are coming in contact with the patient with the dog just during the supervision. Next, send patient to the hospital for the antiretroviral retroviral therapy, and inform the medical officer about the incident for taking control measures at the community level. Okay, so that was about the dog bite. Next is a snake bite. So that is the bite from the snake, and that can be lethal. Okay, so it can cause death of the patient. Next is the snake bite. Make the person lie down. Do not allow him to move. And one main thing in the snake bite is that you have to uh, tie that part, okay, the surroundings of that part, so that the poison may not spread out from that localized bite site to the next body parts, especially to the vital organs. You have to tie it properly and tightly. Okay. So find out the kind of the snake, whether it was poisonous or the non-poisonous. Poisonous, then tie tourniquet just above the bite and continue to loosen it up every half an hour. Okay. So that is the management. Likewise, I said, make a cut of 1 centimeter length and half centimeter deep side at the site of bite and try to suck and discard the poison from the site using breast pump or vacuum syringes. So that is the treatment for the, we can say that the first aid management. Okay. Console the patient and give him hot tea or coffee to drink. Send him to the hospital as early as possible for the anti-snake venom. Okay. And if non-poisonous, then clean the wound with saline water, apply tincture iodine, and refer to the hospital. These are the basic management techniques if a person has a bite of snake. Okay. Next is the scorpion bite. So this was about the category of the bites, that is dog bite, snake bite, and the scorpion bite. Scorpion is likewise said in Hindi or Punjabi it is bichu. So that is the bite, and how can we manage that? Is remove the sting and put ice on it after thoroughly cleaning the place. We have to remove the sting, apply tourniquet above the place of bite, and remove it after half an hour. And give analgesic tablets to relieve the pain and sweeten milk to drink. And if the patient is in shock or has breathing difficulty, so that indicates that the patient is in the condition of shock and airway is not maintained in proper way. So immediately send him to the hospital. Okay. Next is the hemorrhage. What is hemorrhage or how we can manage that is, so hemorrhage is the bleeding from the side. So how can we manage? Lie down the person straight on the back, take the BP and the other vital signs must be checked properly. Okay. Press a pad on the point of bleeding as it is hemorrhage, continuing doing this for till the bleeding stops. Until the bleeding stops, we have to apply the pressure from the external pressure has to be applied on that organ or the skin. Do the bandaging once the bleeding is under control. After the bleeding stops, you have to do the bandaging. Okay. Next is give him liquids to drink. Keep him warm and reassured so as to prevent the condition of the shock. Try to find out the causes of bleeding. And next one is monitor the state of shock, and in case of bleeding or condition of the shock getting out of control, immediately send the patient for further treatment. If the bleeding or the hemorrhage is in severe condition, then don't wait for any of the first aid procedures. Then immediately refer the patient or send the patient to the hospital. Okay. Next is unconsciousness. So as the name indicates, the person will not be oriented to the time and place or person. So unconsciousness can be from many of the factors, or the we can say that the condition like the epilepsy, from the heat stroke, or in the condition of shock, patient may become unconscious. So there are multiple factors of the causes. Okay, so unconsciousness, how would we manage that? Place the person in such a position that his respiratory system works and properly. So that is the main, we can say that the priority that we have to manage, that is to maintain the patent airway, because if the airway will not be maintained, that can lead to the death of that specific person during the unconsciousness. Do not give anything by mouth. That is the reason or the logic behind this is because if we are giving something from the mouth, that may get stuck or choking may be there, and airway will be blocked, and that can lead to death of the patient. So during unconsciousness, or if the patient is unconscious, don't give anything by mouth. Next is place the person in a well ventilated place. Open windows for the fresh air to come. That is reason being the same, to maintain a patent airway. Take his vital signs. Sponge with warm water when the temperature is 103 degrees Fahrenheit or more. Remove the dentures if any, because they can cause obstruction, or they can also cause, during the unconsciousness, they can also cause choking. Okay. Clean excretions from the mouth. For this, we have to perform the suctioning, reason being the same, to maintain a patent airway. Loosen the cords from his neck, chest, and waist. Provide artificial respiration in case of blocked breathing. During, if the breathing is blocked or the patient is unable to breathe by himself or herself, so immediately we have to start the artificial respiration. Okay, and try to find out the reason of the unconsciousness and send the patient to the hospital at the earliest. So these are the uh, standing orders for the maintenance of the unconscious condition in the patient. Next is the poisoning. So that is not the poisoning from any of the, we can say that the bite of the insect or the snake or the scorpion. That is from the engulfing of the any of the poisonous material. That is, for example, the pesticides or any of the poisons. Okay, so for that condition, how can we manage? First is ascertain the history of taking poison. Why that specific person has taken that poison? Is he or she is committing a suicide? Is there a history of the suicide? Is the person under depression or any other type of factor that is involved? So we have to ascertain for the history. Second one may be an accidental or a suicidal attempt. Likewise, I said. Next, watch for the evidence of the type of poisons, labels, prescription, whatever may include. Check for the presence of that type of poison. What was that? What was its? We can say that the labels. Okay, so check for that and check consciousness level of the patient. Okay, so we have to perform the Glasgow coma scale, we can say. Okay, so from that we can check the consciousness level. Okay, next, if within half hour and conscious, give 1 glass of water with 1 teaspoon of salt to drink to cause vomiting. So we have to induce the vomiting so that we can induce the vomiting so that we can decrease the quantity of the poison in the body of the person, so that the blood it should not be mixing, or it should not circulate in the body, so that we can prevent the vital organs from the effect of the poison. Okay, more than half hour unconscious, give glass of warm milk, and if unconscious, refer immediately to the hospital because it is the condition of the emergency. Then immediately refer that person to the hospital. Okay. Next one is the epistaxis. That is the nose bleeding. So mostly that is seen in many of the persons during the summers, or when the heat is very. We can say that in excessive heat or heat stroke conditions. Okay. So blood from the nose. It is known as bleeding from the nose. So blood ooze out from the nose. That is epistaxis. So how can we manage epistaxis? Make the patient sit up with head erect and bent forward. Loosen all the clothes from around the neck. Okay, and ask the patient to clench nose at the junction of hard and soft parts. So that patient, the person has to clench his nose. Do not let him to blow the nose. So he or she just have to clench the nose, but don't blow any of the air pressure in that. Apply cold compress. That would be beneficial to stop the bleeding. Pour cold water from head downwards toward nose. Collect water in a container. Refer to the hospital if the bleeding is not stopping. Okay, or not control, or if the patient is elderly. Okay, so that is the basic management for epistaxis. Okay, next is the abdominal pain. So that is the last topic for the today's topic, subtopic. So rest of the minor ailments I will explain in the next video, because it is a very I am explaining them in a detailed version. So I will make a fourth video of minor ailments part 4, and rest of the minor ailments I will explain in that video. Okay, so that is abdominal pain, mild level. Okay, so mild pain may be intermittent. Patient does not look sick, because commonly we can suffer, or we are having the different types of pain, like in the abdominal pain, for example. So for example, when we have eaten in some excess, or there is overeating, so we can have the abdominal pain for some time. Okay, so that's the mild pain. We don't feel sick. Okay, no vomiting or abdominal distension. We just, there is a mild pain in the abdomen, may be present before meals. So assess for the history of the passing worms in the stool, and treat as per the following schedule with piperazine and albendazole and levamisole. Okay, so these are some of the syrups that can help to reduce the mild pain, like the syrup piperazine citrate for the children 1 to 5 years, and piperazine phosphate tablets for the children above 5 years and adults, and oral dose of 75 milligram per kilogram of the body weight, with a maximum individual dose of 3.5 grams for 2 days. So that could be beneficial to relieve the pain. Along with that, table mebendazole 100 milligram twice daily for 3 days, and levamisole, a single oral dose of 2.5 milligram per kilogram of the body weight, or maximum 150 milligram can be given in the case of abdominal pain. Okay, so that is all about the today's topic. That was from till up to the abdominal pain. Okay, in the next video I will explain you about the abdominal pain of the severe condition, constipation, heat exhaustion, anemia, and a lot of this. Okay, so that will I will continue in the next video. Okay, so there will be the 4 parts of this video, and that is very that would be very beneficial for you. So I will try to attach this the copy of this PDF with this video, so that you can download and can have the notes of this video, or of this topic. Okay, so okay friends, we will meet in next video with the new topics. Okay, so for that time, okay, bye bye, good evening everyone.